Good morning. This is Melissa.
Good morning. How are you?
I'm good. How are you?
I'm good.
Before we get started, is it okay if I record this for credit?
Sure.
Okay, perfect. Thank you. How are you doing
And
today?
just, I'm good. Just so you know, I'm going to be hopping in my car driving to work.
Okay, no worries.
The background noises, it's just because of that.
Yes,
It's
ma'am.
just the best time to coordinate a call with you.
Yes, ma'am. That's totally fine. I understand.
Okay. All righty.
All right. So, can you tell me kind of about like a little bit about yourself and like your professional training and experience?
So I consider myself an obesity scientist by training. There's not a degree in obesity per se, but
Okay.
I started off my undergraduate degree was in biochemistry. Um, I got interested in that because of a research experience I was fortunate enough to have when I was a high school student.
All right.
And so that's where I kind of fell in love with research and science. And then uh, I really enjoyed the research, but I found that I was always seeking to figure out how to apply the research more to impact human health.
Right.
So when I finished my undergraduate degree in biochemistry, I wanted to continue on in school, but I wasn't quite sure how. I had considered, maybe a graduate degree program in something like physical therapy or physician assistant. I'd already kind of ruled out going to medical school because I had shadowed a physician and that didn't interest me. And um, so I was kind of struggling to decide
Right.
what am I going to do with this degree in biochemistry? I did not just want to do biochemistry research because it seems so um, mechanistic, and I couldn't always understand the application of it
Okay.
and why it was important. For example, I was studying mitochondrial DNA in dairy cattle
Oh, wow.
in this lab, in this lab um, that I worked in as a high school student, and I didn't really have much interest in dairy cattle or their mitochondrial DNA and their genetic inheritance patterns for milk production.
Right.
So I think what happened is biochemistry does have application. That's why people are doing the research. But as a student, I had a hard time understanding I understood the application, but the application didn't interest me. So I was trying to figure out as I finished my degree in biochemistry, what can I do that will where the science that I'm doing, maybe using biochemistry, molecular biology, that the science I'm doing will directly apply to content area that I'm interested in. So I decided I would get a job working in a lab and just as a to get more experience and to support myself and then use that time to figure out what I wanted to do. I knew I wanted some kind of graduate degree, but I just didn't know what.
Right.
So I took 2 years. I got a job in a different city from where I did my undergrad, but I purposefully looked for jobs there because there was a large um, academic medical center there. So I wanted to be able to have access because I knew I wanted something health related. So I wanted to be able to have access in a place that would have degree programs that were health related. As you can see, my concepts were all kind of fuzzy. so so I said, well, let's at least get a job in this town that has a medical school and large medical research facility because maybe that'll help me. I'll be around people who maybe are doing stuff that I would find interesting. So I got that job um, working in a lab for 2 years. And I used that first year just to figure out, what might I want to do? That was my goal, was to have an idea at the end of that first year what I want to do. Use the second year to apply to different graduate programs and make a decision. And I found it was important that I had that kind of time limit in my head because job I had, there were several other friends I made during that time who
Mhm.
worked in similar lab settings, and they didn't really have that kind of time limit in mind, and they were mostly just dissatisfied with their jobs. They were kind of bored by it, but they weren't really making progress to figure out where to go. So um, by that second year, I was applying to graduate schools and had discovered that I'd always had an interest in nutrition, um, and even more specifically, weight loss, obesity. I had come from a family where my family had struggled with weight. My mom was perpetually on, the next weight loss diet, fad, and so forth,
Right.
trying to manage her weight. And so, but I had not chosen to major in nutrition in college because I thought a career in nutrition was being a dietitian. And I thought being a dietitian was just about designing diets for hospital patients. I didn't realize there was much more to it than that. Now I understand it's a much more diverse and nuanced um, field. So what happened during that first year of exploring, I discovered there were graduate programs in nutrition where people were learning to apply the kind of basic research skills that I had really enjoyed in high school and my undergrad, but applying them to nutrition questions. And so that sounded much more compelling to me. So I started applying for graduate programs in nutrition, more or less thinking I wanted to focus on obesity and weight loss, but mostly just thinking, get a solid foundation in nutrition. And biochemistry is actually overlaps tremendously with nutrition because uh, there's, all the molecular mechanisms within our body are, are driven by and require various nutrients. So fundamental to nutrition is biochemistry, but when we talk about a career in nutrition, you're also talking about other aspects of ensuring people have access to healthy food and are motivated to eat healthy food. And
Right.
it goes beyond the biochemistry. There's behavioral science involved, there's food systems involved. It's really diverse. um, so at this point I was just thinking, this is really cool. I love biochemistry, and biochemistry is basically nutrition, and I'm going to start applying my basic science skills towards research questions that I'm more interested in, moving beyond that mitochondrial DNA and dairy cattle. This project. So I ended up getting accepted. I was told that there were kind of the top 3 universities in the country for nutrition, that one of them was University of Wisconsin in Madison. I was still a little kind of like, I don't really know what I'm doing. I'm just jumping in here trying to figure this out. So I didn't apply to all 3 of those top schools because one was on the West Coast, one was on the East Coast, and I was in Iowa at the time. That's where I spent most of my youth and where I'd done my undergraduate. So I applied to University of Wisconsin and several other Midwest universities that have nutrition programs. Because I had been told that Wisconsin was one of those top 3, when I got accepted there, it was kind of a no-brainer. I just said, okay, that's where I'll go. So I went to school there thinking I would get a master's degree first and then try and decide if I wanted to go on to get a PhD. But I remember in that first month just loving everything about the program and thinking, oh my gosh, I found the perfect fit. This is what I'm meant to do. And so I committed to doing the PhD right from the beginning. So I looked, when you're in graduate school in this kind of research program, you need to find a research home in addition to taking your courses. I knew all this because I had worked in labs. That was a big advantage. I could have understood how graduate school works before I got there. So I knew I needed to find a professor who was doing research, was willing to take graduate students, and hopefully have funding for paying them on research assistantships. And ideally, I would have chosen a professor who studied obesity. where I asked about that, and there was really no one at the time who had openings in their lab for grad students focused on obesity. So instead, I just kept an open mind, looked at different uh, professors, and um, our program had a process. They actually, where they pulled all the first year students together and had professors who had openings in their lab come and give short presentations about their research. And that's when I heard a presentation by the professor who would eventually become my graduate dissertation advisor. He gave a short talk, and I just really liked his approach. He was a nutritional immunologist, so he wasn't studying obesity per se, but he was looking at this interface between immunology and nutrition. What I really liked about his approach was it was very creative, innovative. He thinks outside the box, and he was really driven by the end application of the research question. So all of his research projects had real world, big impact kinds of end game in mind. Some researchers, when they talk about their research, they get kind of lost in the details, like, oh, I'm trying to figure out, how this pathway is regulated by this molecule. And that was the same reason why I didn't want to go on and get a PhD in biochemistry. I'm like, no, I'm in this for understanding the application. So the fact that this one professor in particular really talked about big picture, why is this important? That just appealed to me. So I ended up getting accepted to work in his lab, and my dissertation focused on a particular kind of fatty acid called conjugated linoleic acid and how it impacts the immune function. He was doing several CLA immune function and fatty acid immune function projects, and the one I took the lead on was specific to a kind of immune reaction called type 1 hypersensitivity, those are the kinds of immune reactions like allergies and. So I did again, it was still basic science research, but I was using, my previous research had been more at the cellular level, doing cell culture and molecular techniques in the lab. And in this particular project, it was a little more at the whole animal physiology level, where I was manipulating the nutrition and then, causing the animal to be sensitized to an allergen, and then studying the effect of the specific dietary intervention on those allergic reactions. Still looking at molecular levels like release of histamine in different tissues, or expression of RNA to make protein and things like that. So it was a really fun project, and I loved the research area, but I still always had this inkling that I wanted to study obesity. So what I decided to do was kind of keep my eye open. When you finish a PhD and you're planning on a research career, for most career paths, you need what's called postdoctoral fellowship training. So you continue to work with another researcher, more senior researcher. You've got your PhD and you're kind of in a fellowship training mode. So you're not still a student, but you're not quite independent on your own, responsible for a research lab or a research clinic and so forth. So I decided I hadn't gotten too far down the path of planning my postdoc experience and applying. When I was at dinner, I was a speaker at a conference, and there was another speaker there who was from my same university, another professor, who also happened to sit on my graduate committee. And so we were sitting next to each other at dinner, and he said to me, what are you planning to do for your postdoc fellowship? And I said, well, I haven't figured that out yet. He said, I think you should come work with me. And he happened to be a professor who studies obesity.
Oh, cool.
He's a physician scientist. So he had a lab where he did, more basic science experiments, but he also had a clinic where he ran studies with humans. And it really appealed to me to learn. I kind of progressed from understanding how to use really basic molecular biology techniques to answer research questions. That was kind of my undergrad years. And then during graduate school, continuing to use those basic techniques, but applying them in kind of whole animal physiology models. And I was going to be able to continue doing that in his lab. He was interested in my immunology background because he studied a virus that causes obesity.
Oh.
And but he also did work with this particular fatty acid that I've been studying called CLA, but looking at its effects on obesity. And he was, it just so happens about the time I started in his lab, he got grant funding to do a clinical trial. So studying the effects of that fatty acid in humans using a weight loss protocol. And so that's where I ended up going for my first postdoc fellowship, was working with him. And that's really how I got started doing obesity research. And I just really loved the field. I felt like this was where my passion was really what I wanted to focus on. And so that's kind of how I shaped my career at that point. And I had a series of other training, postdoctoral training, where I continued to work with him, but also with other people. Then I ended up with a job in a clinical department. This was all still in Madison, Wisconsin, where I studied. There was a clinician there who was really interested in how obesity affects women's health, and especially women's fertility, because he does a lot of treatment work with fertility. So I got to study a particular metabolic disorder in women called polycystic ovary syndrome, and designed a study to kind of look at the energetics, what happens in women with PCOS differently from women with PCOS, and does obesity influence that? And so I got to learn some really cool techniques that are important in human research in obesity during that time. But that was all of these jobs since graduate school through this time were all funded through grant, which is pretty typical when you're in kind of that early career postdoctoral fellowship time. But it's very tenuous. You still have a job as long as you're bringing in grant money. That's not super stable, and it's a stressful, kind of exhausting way to live your life. So
I can imagine.
the whole time I was still applying for, what in my head seemed like real jobs. I mean, those were real jobs that have more of a permanent, long-term position nature to them. And I had several job offers that, for various reasons, didn't feel like the right fit. I didn't accept them. But then I got an offer with the USDA. And so U.S. Department of Agriculture has an internal research arm called the Agricultural Research Service. And within that Agricultural Research Service, they study all kinds of things, from forestry to animal science to crop science. But nutrition is one of the big arms within the Agricultural Research Service. Mm-hmm. And they have human nutrition research centers, 6 of them throughout the country. And I applied. There were job openings in 2 of those where the job focused on obesity. And so I applied to those positions, and I ended up accepting a position working at the Human Nutrition Research Center that's in Grand Forks, North Dakota. Most people don't even know it exists there, but it had been there for over 30 years by the time I joined them. Really well-established research center that had been focused on trace mineral research and nutrition, but had just a year or 2 before I went there had switched to focus on obesity. So they were looking for new obesity scientist positions. And so I got hired there and was put into a position of lead scientist over, with a team of other scientists to run a research program there. So I got to do some really cool experiments there because it was the most well-equipped research facility I'd ever been in with regards to the staff and the facilities and the equipment and so forth. But the leadership there was really toxic. I wasted a good 50% of my time most days, more than that on some days, just dealing with politics and people who were upset because the center director had done something horrible. And so anyway, it became clear that it was going to be hard for me to be really successful there because I was going to have to pour so much energy into all the nonsense that was caused by poor leadership, which is unfortunate, but it's good to recognize it happens in life. And,
Yeah.
and sometimes you have to make your career decisions based on that. So I didn't have to leave that job, but I told myself I was going to keep my mind open. My kids were also at an age where if we were going to relocate, I would rather do it then than later. They were both kind of early preschool and early elementary school during those years that we were in North Dakota. So it was a great place to live, great people to work with, but really toxic environment. So I said, I'll just keep my mind open in case other opportunities come up. But I wasn't like urgently looking for another job. But as chance would have it, a recruiter called me a few months after I had kind of come to this realization and said, hey, I have this job in El Paso. Um, we'd like you to interview for it. You know, one of your colleagues highly recommended you. I listened to the job, and here I am doing all this, mostly now human research study types of research questions. I wasn't doing as much in animals anymore. It was much more at the clinical research level or human subjects research level. And what this person was asking me to apply for was a job that would be in charge of changing the prevalence of obesity across the whole region, which requires understanding the individual level of obesity, you know, for humans, of course, but actually required skills that I didn't have training in and was, you know, beyond what I had ever formally studied or had experience with. But I had been involved with a national organization since my first postdoc fellowship called the Obesity Society. And at their annual conference, they cover all aspects of obesity. So they have scientific presentations on, you know, molecular mechanisms of obesity and the latest research in that area, on human studies research, on clinical treatment of obesity, but also on things like community-based strategies to address obesity at a population level, or public health strategies for obesity, policy-based work focused on obesity. So because of that exposure through this national organization and interacting with colleagues more broadly and globally in the field of obesity, I was able to put forward my thoughts about how you would address obesity on a regional level, apparently in a convincing enough way that the search committee offered me the job. So I came to El Paso to start this new research center with kind of this underlying focus of addressing obesity regionally in the Paso del Norte region. And have you heard the Paso del Norte Health Foundation?
I have. Not until I looked you up a little bit, but yeah.
Someone there sent you to, didn't they?
Yes, ma'am.
Yeah, that's right. So, so before I go to this next part, have I said anything that you have questions about? Sorry, it was kind of a long rant.
No, I loved it. It's like super informative, and you're like answering all my questions along the way, so it's perfect. Yeah.
Our foundation is a private foundation that was created when a local hospital was sold. A public local hospital was sold to a private entity, and this commonly happens. I didn't know this at the time. I learned all about this world of foundations. It's a whole world in and of itself after I moved here. So I'm just kind of giving you a quick synopsis here. But what will often happen is it can be referred to as a conversion foundation. So it's when public entity is sold to a private entity, then you know it's I don't know. There's probably legal ramifications, but also just what's considered good is to take the proceeds of that sale and do something good for the community, right? Because in this case, this hospital that was publicly owned had a lot of public investment in it. And so by selling it to a private company that was now going to take over running it, but you know, they're now on their own, they're going to make a profit, and that's how they're going to keep it afloat. What are we going to do with that money that essentially the the public should get the benefits from that sale because it was all publicly owned.
Right.
So one, I I really don't know a whole lot about this. I just know what happened in the case of the foundation. So what they did was the money was invested, and they set up a foundation with a board of directors and everything to oversee it that would use the proceeds of those investments. So the money that comes, and it's all regulated through tax codes, and it's a whole complex world in and of itself that I won't bore you with details, and I don't know most of the details, but they get special tax exempt status if they use that money, in a responsible way to help the community. So there's foundations like this all over the world. This is just one, and this is one type of foundation.
Right.
So in this case, the founding members of the board decided that they would focus on health promotion and disease prevention. Having been money that came from a hospital, they kind of decided, hey, why don't we try and take this money to help our community not need hospitals so much? How can we keep people from developing diseases in the first place?
Right.
So that's kind of the broad premise of the Paso del Norte Health Foundation. And I don't think that's at all what your paper is about, but I just wanted you to kind of understand where the funding for the start of this center came from.
Right.
So what they were doing at that time, so this was 10, 12 years ago, they were starting to use a model that has been described for solving complex problems at like a community or population level. And the model is called collective impact model. And if you want me to send you a citation or a reference about that, you can also just Google collective impact.
Okay.
Lots of papers and so forth on it.
Right.
There's a paper from, I want to say it's 2011 or 12, Stanford Review is the name of the journal. Stanford Review something or other is the name of the journal. And it talks about this model. Collective impact means that by using this model, you are more likely to coordinate efforts and drive bigger impact and a more sustainable impact than if you don't use this model, which happens in most communities. You've got people who are maybe trying to do similar types of things, and they're kind of all good intent and they're out there doing good work. But when it's not coordinated, it's less likely to have as much impact. So you have smaller isolated impacts instead of collective.
Right.
And the model for collective impact says that if you have 5 components, you're more likely to drive collective impact. And one of those 5 components is the backbone or organization that ensures coordination and making sure that those 5 components are all working together. So at the time, and the other components of collective impact model are to have a common agenda, which means partners who all have a similar goal agree upon what's our agenda, what are we trying to accomplish, so that they're working towards shared goals. So a common agenda, continuous communication, mutually reinforcing activities, and then a shared measurement system. It sounds kind of obvious, but it gets missed a lot in this kind of work, that we don't measure if we're having an impact, or we don't measure it well, or we measure it in a dozen different ways that are like comparing apples to oranges.
Right.
So a shared measurement system for collective impact model can be really powerful, because you can't determine if you're successfully reaching the goals of your common agenda if you're not sussing it. If you're not measuring, okay, this program was intended to have this impact. We don't measure change in that particular outcome that we're interested in. We don't know if we're having that impact.
Exactly.
Well, we don't. So by measuring it, we can tell, is it working, is it not working? And usually it works a little, but maybe not really well. And then you can figure out from other evaluation data how to improve it even better. So that shared measurement system is important, because if you now have a dozen partners who all have some shared goal, like one of the goals in our common agenda was to increase fruit and vegetable intake throughout the region. and it's a really common, popular goal to like a lot of community organizations like to target that for various reasons. I'm sure you know of community programs that try and get people to eat more fruits and vegetables.
Right.
But if we measure fruits and vegetables, there's lots of ways you can measure did a certain program or a certain policy or some other kind of change in the community change fruit and vegetable intake. You can measure it so many different ways. But the problem is if you measure it all those different ways, you might not you almost always can't compare them. So if what you're trying to do is find out, okay, we have 6 organizations during this year that are doing programs to increase fruit and vegetable intake, and they all 6 measure it in a different way. One uses a 24-hour recall of the participants where you sit them down and you say, tell me what you ate for the last 24 hours. And another uses something called a food frequency questionnaire, which is a survey type of tool that says, how often did you eat apples in the last week, in the last month, in the last year? How often did you eat carrots in the last week, in the last month? So food frequency questionnaires are often used because they're easy, but you can imagine they're not very accurate. Can
No.
you accurately tell me how frequently you ate something a month ago and 6 months ago? And
No.
I mean, it's almost ridiculous. You don't have to be a nutrition scientist or an assessment specialist to know it's ridiculous to think that kind of tool is going to be very useful. So we've got this problem with shared measurement systems that oftentimes the work we're doing is hard to assess. And if we're using different tools, if one group has people write down what they eat for 3 days, which is called a 3-day diet record. Another group does a 24-hour recall. Another group does a food frequency questionnaire. You cannot compare those to each other. So if you see a change in something, you can't really know, is it truly changing to which you can't say this group had a greater impact than this group. This program worked better than this program because you're comparing tools that aren't measuring the same thing. So, and then on top of that, for this work, it's in nutrition and physical activity work, it's really hard to accurately assess anyway if you're using self-report, which most community organizations do. And then most community organizations don't even use more standard tools from the research field. They just make up their own survey questions and ask people, and then they report on that. So the science of the assessment of the measurement is really poor typically in community settings. It's not a criticism of those community organizations. It's based on the resources and the knowledge and the skills. So going back to the Health Foundation, they have initiative areas in various different types of health. Like at that time, they were working in like smoking and tobacco and vaping, alcohol abuse, mental health. And then ever since they were first founded, they had something going on with regards to healthy eating and or nutrition and physical activity, active living. How they packaged that had varied over the years, but they decided to bring it together under one initiative that was administered, as one initiative called Healthy Eating, Active Living, or HEAL, HEAL. And so what they wanted to do was to apply collective impact to healthy eating, active living in the region, with the goal of impacting obesity. So they had a little bit of a misperception there that we can talk about more with regards to obesity and thinking that obesity is just about nutrition and physical activity. It absolutely is not. And I was able to start to work on their perceptions about that during the interview process and look into it and so forth. So I was able to bring that forward in our strategic planning when we started our research center. But so I was basically hired to start a center that would serve as the backbone organization for the HEAL initiative of the Paso del Norte Health Foundation. That's what brought me to El Paso. So I was the founding executive director of that center. It was a partnership. It was funded by the Health Foundation. The way the Health Foundation goes about getting things like this started is they will put out an announcement called a request for applications. And in that application, they said, we want someone to start a center. We'll do this. And whoever responds to that with a proposal that meets the expectations of the foundation, then they can get a grant to do it. And the response to that request for applications came from a partnership of universities, including UTEP, Texas Tech, and UT Health Science Center School of Public Health. And so you're at UTEP, you know what UTEP is. I'm guessing you know about Texas Tech here in El Paso. It's medical school, nursing school, dental school, and so forth.
Yeah.
So Texas Tech Health Science Center. And then UT Health Science Center is UT Health Science Center at Houston is the official full name, because there's actually UT Health Science Center in San Antonio as well. And there might be one or two other ones, but UT Health at Houston is a large university based in Houston that has a medical school, a dental school, biomedical informatics school. I think there's one I'm forgetting, and a school of public health. And their school of public health is like the top ranking school of public health in Texas. And it's one of the top, I forget, handful in the whole country.
Oh, wow.
And so the UT Health School of Public Health has 6 campuses, because a long time there, the university itself is over 50 years old now, I believe. But several decades ago, the leadership started to recognize, if we're really going to do a good job with public health, we need faculty doing research in all parts of the state. So they started establishing campuses. And the campus in El Paso was established 30 years ago. That's how long we've been here now.
All right.
So we're located in the Cardwell Collaborative, and we've been there for 3 years. That's the building where Medical Center of the Americas is located. I don't know if you're familiar with the building.
No.
It's right off of I-10. So if you drive along I-10, you've probably passed it, every single time you drive on I-10. It's a big-ish, it's not super huge building. It's only 3 stories, but it's got glass all along one side that faces the interstate. So when it first got built, maybe 10 years ago or so, it was kind of noticeable, because it's a really pretty building right along the interstate. And it's at the Reynolds exit. So kind of the same place you exit if you're going to Texas Tech or UMC. It's that same exit, but it's right on the interstate, so you can see it as you look. So that's where we're located now. Previously, we were located in space owned by UT, because we're all part of the UT system, and the Board of Regents had said, hey, you guys should just share space. But now we're in a separate space. So I think that co-location with UTEP caused most people to be confused that UT Health was just part of UTEP. It's not, it's a separate university. But
Right.
So this initial partnership to apply for the funds to get the center started was a 3-way partnership, UTEP, Texas Tech, and UT Health. But the Health Foundation said they wanted the administration of the grant to happen through UTEP. So when I was first hired, I was a UTEP employee, and we were administratively managed through UTEP, but we were physically located in Office Space Tech, because that's where the foundation wanted us to look. And then it's kind of a long, complex story, but over the course of about 5-6 years, I got the center built. We were doing really well, but there were leadership decisions at the high level at UTEP that were kind of keeping the center from being able to kind of pass a certain ceiling, just because of the way that the funding was being managed and the way the integration into the university was happening. Right. So I made a strategic decision to move the center from UTEP to UT Health. So now we're administered under the UT Health umbrella. So now my faculty appointment, which used to be at UTEP, is now at UT Health.
Okay.
So I've had a professor title at both of those schools, but I'm currently at UT Health. But the purpose of our center is still the same, to impact obesity throughout the region. A lot of that work focuses on healthy eating and active living. But what's important, and we still use the collective impact model, but unfortunately, the Health Foundation, and this is common in foundations too, where they'll kind of focus on something for a few years and then their attention gets pulled somewhere else. So their attention has been pulled away from collective impact model. So they no longer fund backbone organizations. And that's true across all their different initiative areas. They used to have a backbone for alcohol, they used to have a backbone for smoking, mental health, and so forth. And they're kind of not really, I'm not capturing this very accurately. So don't try and use how I'm describing it to say this is the foundation. Yes, I mean, if you really want to cover the foundation funding, you should interview program leadership, like their VP for program at the foundation. But I'm just describing it briefly so you kind of understand that it's still my intent to address obesity regionally, and the collective impact model is an effective way to do that. It's a really tricky model to implement, though, if you don't have that core kind of funding, like the foundation provided to get us started. So using collective impact is different than what a lot of academic research centers do. Most academic research centers focus on research questions and research grants. So they'll just have these discrete projects that may be very powerful, very meaningful projects, but they may not plug into a larger coordinated effort, which is what collective impact model does. So what I'm trying to perpetuate here and continue to grow is an academic research center that uses collective impact model, but it is really challenging to do that. The way universities and funding mechanisms are set up makes it really difficult to do that. But that's kind of probably beyond the scope of your paper. I just wanted you to have sort of an understanding of what makes our center a little different than traditional research centers at universities. So I continue to work on this big picture goal of impacting obesity. We do have, the restructuring, moving from UTEP to UT Health meant that things were up in the air for a while. Some of my staff needed, because it was all funded through grants and we weren't quite sure what was going to happen with grant funding, some of those staff had to, consider career changes. And a big part of my team was graduate students who have now finished their graduate work and moved on and so forth. So we've had, how we look today is a lot different than how we looked 3 years ago or 4 years ago. Plus we had the pandemic hit, of course, which makes everything different. But we've had our work continue that whole time. But our team looks different, the makeup of our team, and I'm in the process of rebuilding it. So by switching to UT Health, one of the biggest advantages is that I got commitment from the university to hire additional professors to be part of the research center. And that's a big thing I could not convince UTEP leadership to do. They weren't even paying me as a professor. I was paying my own salary off of the grant money that I had gotten. And that was part of the problem. I couldn't keep paying my salary off of grant money. I needed to get paid by the university for the teaching and the administrative work and mentoring of graduate students and so forth. And nobody at UTEP was figuring out how to make that happen. So now I get paid by the university. I also get paid by research grants. That's pretty typical in a university setting, that faculty are expected to cover part of their funding from grants, and then part comes from the university, which is, in our case, state money. And I'm in the process of hiring additional faculty to join our team, so more professors, which will help us, of course, expand our impact and the capacity of work that we can do. With that same focus of big picture, addressing obesity, but really focusing on what the community needs. So that's another thing that often happens with academic research is you've got researchers. To be successful in academia, you need to build your research profile. So you go from one project, you answer the questions of that project, but that typically creates like a dozen new questions that need to be answered. So you build your next research projects like that. Okay. Completely understandable, because that's how you get grants. And grants are a big part of being successful if you're a scientist at a university. What I was able to do, because we had this large grant from the Health Foundation, just to give you a sense, over the course of the first about 6 years of our existence, including about a year before I arrived, there was a planning grant in place. So if you count that planning period plus the first 6 years that I was running the center, we got probably in the neighborhood of $11 million from the Health Foundation,
That's amazing.
which is a substantial amount of money. Because the money was there up front, promised and committed for those years, I didn't have to move to town and quickly submit 5, 6 grant proposals to take my research from when I was at the USDA to the next step. I was able to pause on applying for grants, get to know the community, literally go around and meet with, dozens and dozens of leaders around the community and find out what are you doing to address obesity, to improve healthy eating and active lifestyles, and listen to what they're doing, evaluate what they're doing from a scientific perspective, like are they using evidence-based approaches or not, and then also understand what are the barriers for them being able to do this better. And then talk with them. Like I would bring the science in and I would respect that they're bringing in the experience, the boots on the ground, experience, knowing the community, knowing the culture, knowing, there's a big difference between what science tells us will work and actually getting that implemented in a community setting. So that's another thing that's somewhat unique about what we do, is that we start first at what the community tells us they need. Then we go out and find the science to support that and either adapt existing work to meet the needs of our community, or if it's not out there, we build it with feedback and input from our community. Many times, as I said before, researchers have to start with what they're already doing, and then they go into the community if they need a community setting to test a new approach. They go into the community to try and find partners who they can work with to test their idea. But we want to start with the community to figure out what the idea is even going to be in the first place. So that's a big difference in how we do things. Again, it's different because it's not easy.
Right.
Sorry, my headphone ran out of battery.
No worries.
So we do it that way, but it's not typical because that's not a very easy way to do it. But because we've had this investment from the foundation early on, to at least get started this way. Now we don't have that core funding from the foundation. So, my leadership challenges right now are how to get the fiscal component in place to keep supporting that kind of approach. But at least for now, I'm still committed to doing my best to make it happen. So that kind of gives you a sense of the big picture of what our center does. Our center is called the Center for Community Health Influence. And when we were at UTEP, when we were first founded, the name had been identified before I even got hired, and it was called the Paso del Norte Institute for Healthy Living. But because we were funded by the Paso del Norte Health Foundation, people would confuse those two names, and they kept thinking we were with the foundation, that we were foundation employees. There was just a lot of confusion around it. So when I moved from UTEP to UT Health, I decided to use that as a chance to kind of reboot the name. And so that's what we did. But so if you hear reference to or see anything, like if you look on our website, there's going to be materials that refer to Paso del Norte Institute for Healthy Living, or we would just shorten it to Institute for Healthy Living, or IHL. That's the same. That's still us.
Oh, okay.
And now we're CCHI, Center for Community Health Influence. Same focus, same people, same director, just different name. So, yeah.
Makes sense.
And so that kind of tells you how I got to where I am today. I know that was super long.
No, that was great.
You want to talk more specifically about obesity?
Well, since we went into like El Paso, what would you say, or what's your opinion on like what the community of El Paso needs?
Well, from the perspective of nutrition, physical activity, and obesity, kind of focus on that.
Okay.
Of course, there's lots of needs that branch out from that.
Right.
And so it can be pretty tricky to try and boil it down and separate it because, things like um, uh, poverty play into things like healthy eating and
So actually, that is
physical activity and so forth.
that's actually part of my paper. And one of my questions was like how low income and poverty has a role on obesity.
Yeah, yep. So one of the way I usually describe what we do as a center, I talk about the fact that we use the collective impact model and that we focus big picture on addressing obesity regionally, including healthy eating and active living, but not exclusively focused on nutrition or physical activity. And then I describe our partnership areas. As I said, we're all about starting with community first. So we use community-driven solutions to impact obesity. And to do that, you have to have partnerships.
Right.
So just to give you a sense, we have 5 main partnership areas right now. So these are kind of the content areas. One of those is food systems, and that includes food insecurity and access to healthy and affordable food. And then the other partnership areas are primary care or healthcare in general, because obesity is a complex disease and it has to be treated and managed clinically. It's not just about making sure people have healthy food and know how to prepare healthy food and will eat the healthy food. Obesity is caused by some dysregulation within the body that causes the body to store excess fat at a level that's unhealthy. So if you don't manage that cause, you can do, so much good work all over the community to address what I refer to as the contributors to obesity. But if you're not addressing the causes at the same time, then you're not going to be able to impact prevalence.
Right.
We do a lot of work with primary care providers who recognize, hey, our patients need help. We can't just keep telling them, you just got to eat healthier. That's going to fix it. If there's an internal driver, like if they have a hormonal dysregulation, one of the more common ones is something like thyroid hypothyroidism.
Yeah.
Well, if you have hypothyroidism, you can eat the healthiest food in the world. You can try your darndest to exercise every day, but your body is fighting against you. And It's going to be nearly impossible for you to achieve and maintain a healthy weight unless you treat the thyroid condition. There's at least 100, if not more, because the research world is still working on this, causes of obesity, internal, intrinsic causes. And then in addition to that, you've got all these contributors, like whether or not someone has a grocery store near their house and can buy healthy food, or if they have to buy it at a corner store or a fast food restaurant. Right. So, having only eating energy dense foods like junk foods or fast foods and so forth, that will contribute to obesity, but it doesn't cause obesity, because there's plenty of people who eat those kinds of foods and don't have any impact on their weight.
Right.
Having a neighborhood where you can't exercise contributes to obesity, but it doesn't cause obesity. So what we really have to do is work on ways to address both simultaneously at a population or community level if we want to impact prevalence. Right. And so one of our partnership areas is helping healthcare providers get the training they need so that they're helping identify and address the causes of obesity. But then it turns out the kind of training that's the best practice, I said we try and bring the best science and put it into practice in the community. That training takes a lot of time and a lot of knowledge. Yeah. Healthcare providers, especially in primary care settings, especially in those settings that deal with low-income patients, they don't have a lot of time. So we've invested a lot of grant money in our effort in the last few years to develop tools that help primary care providers better treat obesity with their patients in a cost-effective and time-efficient way. Mm-hmm. And two of those tools are software. software tools that we've built in the last year.
Oh,
And so, like, the software makes it scalable and much quicker to use, which means we can reach more people at a lower cost. So that comes in on the cost front. Um, on the food, just to briefly finish out the 5 partnership areas, we won't have time to talk about all of them. But I say we have food systems, we have healthcare, we have schools, and I don't know if we'll have time to talk about that today, but by targeting schools, you've got a really nicely captured audience, right? Because
right.
all kids have to go to school, kids have families that they are part of. So when you can deliver strategies through schools, you can reach large numbers and at an early age. So we have a lot of work that we've done in schools over the years. So school health is another partnership area. And similar to kind of in parallel to schools for kids, workplaces are a great way to target strategies for adults because you can help a lot of people in a system-wide kind of way. So we have some employee wellness partnership areas. That partnership area isn't as in-depth and broad yet, but that's an area that I'm looking forward to our center being able to expand when I get more faculty there. And then the 5th partnership area, I broadly call it environmental health, because we've done some work looking at things like air quality and how that impacts obesity and metabolic health. We have a big study that we're wrapping up right now looking at public transportation and how that impacts obesity and access to things like healthy food and healthcare and so forth. So 5 partnership areas. When it comes to poverty, one of the biggest areas that comes into play, or 2 big areas, are those first 2 partnership areas I talked about. So access to healthcare to help treat the causes of the obesity becomes a problem.
Right.
Not only can people not find providers that know what they're doing, but then to pay for that treatment if you don't have insurance, and even those who have insurance, we've got big policy problems with how most insurance is handled right now, where insurance companies are not covering treatment of obesity. They cover treatment of the diseases that come from obesity,
Right.
like diabetes and heart disease and cancer and liver disease. But you have to wait till you have those diseases sometimes to get the treatment.
Yeah.
So we're trying to do some work on the policy front to get those policies changed.
That's awesome.
So that people can get the treatment earlier in that chronic disease process, address the obesity up front, not wait until the subsequent diseases kick in. And then the other big area where poverty comes in is food access, of course. So we have a lot of work we're doing to improve the food environment. We've got amazing partners around this region, some that work more on the food production side. We don't do a whole lot with that directly, but we're trying to help integrate the work of those folks with work to ensure that more food that's grown locally. If you're trying to get people, one of the biggest categories of foods that can help improve the nutrition of a diet and decrease risk of diseases like diabetes and heart disease and cancer, but at the same time help with management of a healthy weight, are fruits and vegetables, because fruits and vegetables are nutrient dense but not calorie dense. So you can feel full with fewer calories, still get a lot of nutrients from those. So we want to encourage people to eat more fruits and vegetables.
Right.
Don't be mistaken into thinking that eating fruits and vegetables will cause weight loss.
Right.
But it is important that we have access to fruits and vegetables to address obesity. And so we're working on making sure food systems can include fruits and vegetables that taste good, and that, if you're trying to encourage people to eat fresh fruit or vegetable and it's chucked for 3 days, it's not going to taste as good. It's going to perish in your kitchen much more quickly. Low income people, that's relevant. They don't want to waste money on food that's going to go bad before it gets eaten. And it makes your food system less resilient to food system challenges like a pandemic or a natural disaster if you rely on all your foods come from outside your reach. So there's a lot of reasons why a stronger, healthier, more resilient food system can lead to better health for the people in that food system. So we work with elected officials, nonprofit organizations, and for-profit entities like grocery stores.
Right.
And probably our biggest accomplishment in this area, like the most easily described tangible accomplishment, like I said, it's part of a bigger, more complex process, is that we helped establish Healthy Food Financing Initiative in El Paso County,
Okay.
and which is referred to as HFFI. And I can send you a report that we wrote a few years ago that came out of initially assessing the region through some GIS mapping, some interviews with stakeholders, and some surveys of residents. And then from that report, we had a food summit where we brought together community stakeholders, presented the data, and asked them what they thought would work best to address access to healthy and affordable food in our region. And one of the projects that came out of that was the Healthy Food Financing Initiative, which the county stepped up and took ownership of. So the county has now dedicated, we helped them get a policy in place that sets aside $1 million a year in funds that go to support projects. People can apply for these funds, in other words, with their own project ideas. But the criteria for the project is that it has to increase access to healthy and affordable food. So sometimes it's a food retail project, like establishing a new corner store that's going to sell healthy food. Or another project that got funded was a food hub, where they set up a warehouse in central El Paso so that they could aggregate locally grown food from farmers, get it washed and boxed up and stored in a cold room, and then shipped back out to people who are going to consume it, either end consumers or cafeterias or those kinds of things. So having that food infrastructure can also qualify for this funding. So we're the first county in the country to do a Healthy Food Financing Initiative. It's a model that had been tested in some cities and at the state level in some cases, but we're the first county to do it. So you can be proud of the fact that our county is leading the country in something so innovative.
That is so cool.
Yeah, I know you probably still have a ton of questions. I have a call scheduled that starts now. Would you mind if we just followed up? It'll give you some time to kind of go over what we've talked about. I can call you back as soon as this call is over and wrap up any more questions you might have.
Okay, yeah, that'd be great.
Are you available? This call will probably take me about an hour and a half.
I'm available all day.
Okay.
So,
All right, then this will give you a chance to look over the long, drawn out answers I've given you and see what questions you have, and then we can take another 15 or 20 minutes or so and cover any other questions you have. Is that okay with you?
yes, ma'am, that sounds great.
Okay, super.